Laser correction of vascular pathology in children, possibilities and risks. Congenital vascular pathology of the skin is one of the most complex problems. These defects are encountered by specialists of various specialties: pediatricians, surgeons, dermatologists, and cosmetologists. Congenital vascular pathology occurs in 1 to 3%, with the majority of these patients being children. According to the biological classification, Society for the Study of Vascular Anomalies, we can divide the entire vascular malformation into two large groups: tumoral and non-tumoral origin. These are hemangiomas, benign vascular neoplasias, and vascular malformation or vascular malformations. It bears reminding that hemangiomas can be congenital and infantile, according to the rate of involution: rapidly involutive, non-involutive, and partially involutive; by depth: superficial, mixed, deep, according to the type of vessels involved in the malformation: arterial, venous, capillary, and lymphatic. Congenital vascular malformation of the skin can be a component of various syndromes. Therefore, when suspicious, consultation and evaluation of related specialists are necessary. On this slide, you can see those congenital syndromes that include hemangiomas. This slide contains what is related to congenital syndromes, which include vascular malformations: Weber-Crabbe syndrome, Hippo-Lindau syndrome, Cobb syndrome, Klippel-Trenaunay-Weber syndrome. Hemangiomas account for more than 50% of all skin tumors and soft tissues in newborns and children, and are recorded in 10% in children in the first year of their life. What are the risks? This is the growth of hemangiomas, despite the laser treatment. This is a recurrence of hemangiomas. When we get clinical improvement and after a while, we see tumor growth resume again. For which hemangiomas will laser therapy be most effective? We have conducted a study. Its goal was to improve the treatment of infantile hemangiomas by laser radiation, based on the study of tumors using non-invasive methods. The study involved 122 children with 132 hemangiomas, 22 boys, and 100 girls. The average age was 6.3 months. All patients underwent a clinical evaluation, a non-invasive study, including aerothermometry of both the tumor itself and control symmetrical area of the healthy skin, as well as an ultrasound of the hemangioma. All hemangiomas were divided into 3 groups: superficial, 84 people; mixed, 38 people; deep, 10 people. In the aggregate assessment of the clinical manifestations of infantile hemangiomas, the following significant values were obtained. The blue color of the tumor indicates its deep location. The presence of pulsation during palpation indicates the presence of a large supply vessel with an arterial type of blood flow. If the height of the hemangioma is 3 millimeters or more, and the area is of 10 centimeters squared or more, then this indicates a high progression and risk of complications. If tumor growth is noted in the first month after the appearance, this indicates an increase in volume. For an objective assessment of neoplasms, a study of vascular tumors was carried out by aerothermometry. This allowed us to determine the severity of color in quantitative values. Each child was measured with erythema indicators of both the hemangioma and the symmetric control area of healthy skin. The maximum value in the tumor area was 450 conventional units, whilst the minimum was 125. In the control area, the values ranged from 85 to 110 conventional units. The values of aerothermometry were dependent on the depth of the location of the vascular tumor. The highest values were recorded with mixed lesions. According to ultrasound, out of 132 hemangiomas, superficial ones with a localization depth of up to 0.5 centimeters were significantly more often detected. 28.8% are mixed with a location depth of more than 0.5 but less than 1.0 centimeters. 7.6% of them are deep with a depth of more than 1 centimeter. When ultrasound was performed on the presence of a supply vessel, out of 132 examined tumors, 47 was found to be absent. In the remaining 85, a supply vessel with a maximum diameter of 0.15 centimeters was detected. Most of the tumors had a supply vessel with a predominance of venous blood flow. We included 109 people with 119 hemangiomas in the study for laser treatment. The group of 13 people who did not receive laser treatment included the following patients. Localization of hemangiomas in the periorbital region. There was a chance of retinal damage. Hemangiomas of less than 1 centimeter squared. Dynamic monitoring was performed every 3 months. Such hemangiomas were recorded in 2 children. According to ultrasound, 10 tumors had a depth of 1 centimeter or more, which was the basis for the exclusion of laser therapy. Based on significant evidence, the penetration of radiation into deep hemangiomas did not guarantee an effective result. Based on our study, we developed a patient selection algorithm for laser therapy on the Multiline system. A neodymium laser with a Q-switch KTP nozzle with wavelengths of 1079 and 540 nanometers. There were 3 stages. First, clinical examination, where we excluded localization in the periorbital region and where the hemangioma area was less than 1 centimeter squared. Next, we performed aerothermometry. The indications for the exclusion of laser treatment were indicators that ranged from 135 to 179 conventional units. These values corresponded to indicators of deeply located hemangiomas of blue color. If the parameters of aerothermometry were 180 or more, we performed an ultrasound scan. The indications for the exclusion were the location of the tumor at a depth of 1 centimeter or more and the presence of a supply vessel with a diameter of more than 0.15 centimeters. 109 patients with 119 hemangiomas underwent laser treatment using the Multiline system with a neodymium emitter KTP QSW with wavelengths of 1079 and 540 nanometers. The main advantages of this treatment were non-invasiveness, lack of bleeding, painlessness, and a slight effect on the surrounding tissues. This method of percutaneous laser coagulation has important properties. due to the sequential effect of two wavelengths, coagulation of both the deep line and the superficial pathological vessels occurred. QSW modulated Q factor mode allows generating a train of nanosecond pulses, avoiding overheating of surrounding tissues, causing a risk of burns, dyschromia, and scarring. The clinical criteria at the end of the treatment course were flattening of the tumor, discoloration of the skin, and air thermometry indices of less than 110 conventional units, which corresponded to the control symmetrical area, which was measured during the initial examination. During the control ultrasound, vascular formation and nourishing vessels were not visualized. In hypodermis and dermis, structural changes were not detected in children with superficial hemangiomas of 100%. In children with mixed hemangiomas, 92.1%. In addition, we conducted an aesthetic assessment of the effectiveness of the treatment used. A patient satisfaction questionnaire was used. 97.2% of parents noted the result of laser treatment as very good, while 2.8% chose good. None of the respondents gave a negative assessment. We also used a categorical Global Aesthetic Improvement Scale. Its result was 2.98 out of 3, which means that the assessment of the parents and doctors completely coincided. As a result of our study, we made the following conclusions. We have developed an algorithm for selecting patients for laser treatment on the Multiline system using a KTP QSW neodymium emitter with wavelengths of 1079/540 nanometers, which included air thermometry, the diameter of the supply vessel, the depth of the tumor, and excluding dangerous anatomical locations. With superficial hemangiomas, we conducted a short course from 1 to 5 procedures, with mixed ones from 6 to 10 sessions. The effectiveness of treatment using the patient selection algorithm on the above system was confirmed by the restoration of normal skin and relief staining, the absence of scars in 100% of cases with superficial hemangiomas and 92.1% with mixed tumors. Air thermometry indices, regardless of the duration of the treatment, tumor localization, and clinical form, did not differ after treatment with a control area of healthy skin. Ultrasound after the end of therapy showed the absence of blood flow and structural pathology of the dermis and hypodermis at the sites of hemangioma localization. The aesthetic result of laser therapy was noted by the patient's parents in 97.2% as a very good result. Dear colleagues, I will present to your attention some results of percutaneous laser coagulation of vascular pathology of the skin. On this slide, treatment of superficial hemangioma before, after the course of treatment, and 6 months after the end of the course of treatment. Superficial hemangiomas, before the treatment, after the course of treatment, and in 6 months after the course of treatment. This is mixed hemangioma, a deep location of the tumor. Results before treatment, after the treatment course, and after 6 months. Complex localization of hemangiomas. We managed to achieve a good result. Thank you very much for your attention.